the CDC is warning about a drug-resistant bacteria that's causing a spike in stomach illnesses. It's called Shigella. Doctors say it normally resolves itself with rest and proper hydration, but it can occasionally cause serious illness in some cases that have led to hospitalizations and even sometimes death. Dr. Payal Patel is here to help us understand more about the bacteria. She's an infectious disease physician for Intermountain Healthcare. Doctor, great to talk to you. So, I've heard of Shigella before. This is not new, but why are we seeing this spike and who's at risk the most?
Yeah, that's a great question. So I think that the CDC is warning us about this because just a few years ago, all of the Shigella cases that we saw in the United States were less resistant to antibiotics. And we're seeing an uptick in infections that are actually resistant to all first-line antibiotics. And so that's important not just for the public to know, but really for doctors to know and to look out for in case they see a patient with this infection. And the people who are at risk for something like that are really people who potentially travel to another country, come back to the United States. Kids are often at risk, especially between the ages of 1 to 4. Men who have sex with men, and people with decreased immune systems. These are sometimes the patients that we do see that get this infection.
So Vlad said he had heard of it before, but I don't think I have. I have. So
I heard of it because this is maybe a little TMI, but I don't use public restrooms, not even here at work.
Oh, it's true.
And I had always read years ago, maybe this has been traumatizing to me since I was a child, but I read that you could get Shigella from toilet seats.
Well, what I was going to ask her before we get to how you can get it. Oh yeah, I was going to ask you how can you get it? Is Vlad correct? And also, I don't know what the symptoms are. So how bad is this?
Yeah, that's both all great questions. So, the first thing I would say is Shigella is really, really infectious. And so often what we see is, a child has Shigella, you're changing the diaper, may not wash your hands as well as you really should. That can get a whole family sick. So it often can start with one person. We had an outbreak in San Diego very recently where, just again, a small dose of Shigella can get a lot of people sick. So that's really one important thing to know about it. The good thing is that most people will get better from this disease without really ever having to go to the hospital, without needing antibiotics. So the CDC is warning is really out there to let us know that there's a rise in resistant Shigella, but it's important to know also that just washing your hands really thoroughly, and that's whether you're in a public restroom or helping take care of a newborn, can be really helpful in preventing disease transmission.
I know someone who's doing that, but your baby's at home and most likely not going to get anything.
Wait, doctor, hold on. I thought you could get it from sitting on a public restroom toilet.
I guess that's a possibility.
Right. I know
so
people
are a lot of other things too.
Well, everybody washes their hands, you hope, but I'm talking about just getting it by sitting. Does it make sense?
It totally makes sense.
Yeah, that's a great question. It's really usually hand to mouth.
Okay, thank you.
And so washing your hands really well, no matter where you
now
are.
I got it. All right. Still not going to change my methodology.
I did not understand what you were asking.
Now you get it?
So yeah, but I just want to clarify the symptoms. Like, how would you know that you're coming down with something like this? And then what do you do to avoid it? I guess washing hands is, number one, but.
Yes, definitely. So often it'll start with just really, really bad diarrhea, and it can really progress to have bloody diarrhea. So if you're having bloody diarrhea more than 3 times a day, you're not able to really keep anything down, that is a good time to think about going to the ER. You're probably going to need IV fluids. I would say for a lot of people also, if you're traveling, you're going on vacation soon, going to a place where you're not sure about the water, drinking bottled water in a situation like that can really help as well.
That's good advice.
So why are we seeing a resistance to antibiotics? And is there a way, are pharmaceutical companies thinking about ways to re-engineer? And I know I'm not a scientist at all, but are they thinking about ways to re-engineer the antibiotics the same way we do sort of for the flu vaccine?
Yeah, that's really my takeaway from this is just another example of an infection that, 100 years ago, we had no antibiotics, right? Shigella was around. It caused lots of death in World War I, right? So it's been around for a really long time. then we got all of these amazing antibiotics. And if we overuse or use those inappropriately, we're going to get to a point again where we can't use antibiotics. So my takeaway for the listeners would be, only use antibiotics if you're prescribed antibiotics from your doctor, and try to be aware about antimicrobial resistance and what we can do as just citizens to help make sure that we preserve antibiotics for our children.
It's good advice for us all. Dr. Patel, thank you very much.
Thank you.